first Zoom call, and we will be having these every single week, Wednesday at 10 o'clock in the morning. I did want to put a little plug out there for you that starting next week, we will have our congressman as our keynote speaker. So Desiree will be emailing out the link for that. If you are interested in being on this call every week, please let Desiree know. If you're on our board of directors, you'll automatically get the invite. We had outreach to the ELR group and a select group of other businesses, but we believe that next week we're going to need to go ahead and update everything and maybe go to the larger one. Yeah, sorry about that phone call ringing. Des, we'll have to let it go. It's okay. So what I wanted to do at this time, if you could start the recording, Desiree, because I noticed that all of our speakers are on. And again, I just want to welcome you all, the speakers. We'd like for you to mute yourselves, all of you to mute, and then when the appropriate time comes up, you can unmute yourself and share your comments. Each of the speakers have been invited, and they've got a very limited amount of time, but I do want to make sure that I properly introduce my chairman of the board, who has a vision and a goal this year. His theme is to make history, and I believe that is more true than ever before with the economic uncertainty that we have right now. Please welcome Don Williamson. Don.
Thank you, Bobby. I got to tell you, I grew up in the 60s, and I can only think of the Doors song, Strange Days Have Found Us, because this is really something that's unprecedented that we're going through in any of our lifetimes. And this is challenging times. And I got right off the bat, I want to thank on behalf of the board of directors, Bobby Spiegel and the staff at the Crona Chamber for keeping us going. Desiree Ramirez, who's on the call with us, Linda Richards, who's on the call with us, Stephanie Shapiro, Robert, our salesperson, are just doing a great job on reaching out to our members. Our members have always been the priority of this chamber. And Bobby organizing this call on a weekly basis to keep everyone updated and informed of what's going on. And we're still carrying the business community in this region, and we're going to continue to do so. So I just want to thank them, and I want to thank each of you for being on the call, showing your commitment to our efforts and what we're doing. Right up until yesterday, Eugene Montanez contacted our state insurance commissioner to discuss with him and express his concern with things that are going on. I think some of you might have gotten emails regarding that interaction. But thanks to Eugene, and thanks to everyone who's moving forward and not letting this this bad luck, or whatever we want to call it, hold us back and destroy all the work that we've done throughout the year. So anyway, I want to thank everyone for all that, and look forward to these meetings on a weekly basis.
Synergist, Ken speaking.
Thank you, Ken. Go ahead and mute yourself if you would.
We have joined a Save Small Business Coalition with 80 chambers and associates that are throughout the United States. And you'll hear more about that as we move forward. I just want to remind you right now that this Friday, April 3rd, is our Legislative Action Committee, which will also be a Zoom link. Again, if you're interested in being part of that, please send an email to linda@mychamber.org, and she can get you the information on that coming up. That's the Legislative Action Committee that'll be this Friday, April 3rd. And at this time, it is my pleasure. I want to thank all of our participants. I think everyone has the agenda that we have. I want to thank Dr. Thornburg, Rob Moran, Leah Peterson, Marc Uffer, Jeff Van Wagenen, and our first speaker, our esteemed Riverside County Supervisor for our district, a lot of our personal friend, and we're grateful to Karen Spiegel for being here with us. And Karen, I'd like to turn it over to you.
Well, thank you, Don. You know, we're in a times that's unprecedented. It's a time that most of us will have never lived through, nor will we live through again. And it's a time that we are stepping up to the plate, and everybody has a role that we're playing in this. And firstly and foremost, I really need to thank all of our county staff who have been working 7 days a week. Their phones are on 24/7, and they have done a tremendous job leading us through this with all the information, with the leadership that they are leading us to making sure that we are focusing on the safety of our residents. And with all that's going on, one of the new things, and I don't know if Jeff's going to mention it, but I do want to mention it, is that we are starting a recommendation. This is a recommendation only of to stay in place, maintain your space, and cover your face. And the reason that is it goes along with the social distancing. It's going along with stay at home, because the spread of this can just increase, and we're trying to get the curve flattened. And it is so important that we play our role. And I know that the businesses have been hurt tremendously. And those of us that are reaching out and on a daily basis, we've been trying to eat at least one business a day in the restaurants. We've been trying to support the businesses that are open. And if we all continue to do that, hopefully we can get through this together, because we are a community. And that's what's the most important thing, is that we end together as a community, united. And I want to share one of my key people in the county of Riverside, and that's Jeff Van Wagenen. He is a tremendous source of knowledge and a wealth of information. So Jeff, can you share with us what's going on?
Supervisor Spiegel, thank you for the introduction. Bobby, thank you for inviting me. And Don, thank you for referencing a Doors song that is not "This Is the End." Much appreciated. My name is Jeff Van Wagenen. I am the Assistant County Executive Officer for Public Safety. I'm currently serving in our Emergency Operations Center as the Liaison Officer. Want to give you a quick update on the confirmed case totals. We have a total of confirmed cases of 371. That's 21 in the city of Crona. Unfortunately, we have reported 13 deaths in the county of Riverside. We've now started reporting on the number of recovered individuals, and that number is now at 30. We update our totals daily at approximately 1:30 on our website. Here's the latest information. Our focus remains on coordination with our hospitals on our surge plan. We expect the surge sometime next week. We're hearing from some hospitals that they are below their normal average, but we're also hearing that some are starting anecdotally to see more patients. We're working every day to fill resource requests from hospitals, first responders, and our other partners. I am fielding more than 50, what I call I know a guy referrals every day, and we are chasing them down, trying to identify necessary equipment and staffing. For the, what I'll call the non-traditional vendors, we've involved the district attorney's office to help us vet those vendors. We have stood up a federal medical station, 125 beds in eastern Riverside County in the Coachella Valley. We've selected a site for another 125 beds in the city of Riverside. We're having a site visit from the state of California tomorrow to approve that site. We stood up our third community, AKA drive-through testing site today in Riverside. That is in addition to Indio and Lake Elsinore. The National Guard is deployed for 2 humanitarian missions. First, they're handing out food at a food bank in the Coachella Valley. They're supporting the federal medical station in Indio, and we may seek some assistance from them at the FMS here in the city of Riverside. We have developed a frequently asked questions form for issues related to essential, non-essential businesses. It is updated frequently as we get more calls and more information. We are also receiving a number of calls from people who are complaining about businesses that are still operating in this time. The phone number for that line is 951-351-6866. And I will send these notes, Bobby, to you afterwards so you can push them out as necessary. We have developed a business economic impact survey that we are pushing out. So far, we've had more than 500 businesses countywide respond to that, reporting an economic impact to the bad of $120 million. I'll be interested to hear what Dr. Thornburg has to say about that. As Supervisor Spiegel said, we pushed out a recommendation yesterday to cover your face. That is part of our messaging of staying home. So stay in your place, maintain your space, and cover your face. That's why I've got my mask on today. We have also released yesterday a public version of our modeling. If you have not received that, again, push your questions to the chamber and then I'll get that back to them. Final reminders, rumor control. When in doubt, reach out. A significant portion of my day is chasing down rumors for our partners. Essential county services are continuing on behalf of all of our residents. I would refer you to our website, which is www.rivcoph.org. rivcode.org/coronavirus. That has lots of good information and is updated several times each day. On Twitter, you can follow our public health officer at rivcodoc, RIVCODOC. That's the end of the report from the county.
Don, unmute yourself. So Don, I'm going to go ahead and take this. Leah Peterson, you're next up. Go ahead.
Thank you. Good morning, Bobby and chamber members. I appreciate the opportunity to speak with you today. A few things that I would like to highlight. Number one, if you cannot pay your natural gas bill, so Southern California Gas Company is not disconnecting your service. You do not charge late charges. You will have to pay your bill at some point. You can work out payments with us. You can call our 800 number, 800-427-2200, or go to socalgas.com, and you will be able to find the information you need in order to be able to make arrangements to pay your bill, but we are not cutting off service. Additionally, we've seen an increase in phone scams where people are calling and demanding that people pay an account, and they have to pay immediately. Otherwise, you will end up having your service disconnected. We're not disconnecting service. This is a phone scam, so please report it if you can, and definitely hang up. Southern California Gas Company is considered an essential service. We have to be out in the field to maintain our natural gas systems. We are also responding to emergency incidents. People smell gas, they have a gas leak, anything like that. We are responding to that, so please do not contact the police or sheriffs and try and report us, because we're out there doing our job and we need to be able to continue to work and maintain our system. The other thing I wanted to share is that Southern California Gas Company, working with our Sempra parent company, has established $1 million fund, and that is specifically for nonprofit organizations that they can apply. I have sent the link to Bobby and to his staff. So if you have an interest in applying, this is specifically for organizations that are on the front lines and dealing with those that have been affected by the COVID-19 virus. And that, for a good example, would be like Yolanda's YMCA, because she does meals for both seniors as well as children who are low income. We also, I sit on the Riverside County Workforce Investment Board, and I was able to assist the Riverside County Works, their nonprofit arm, obtain a $25,000 grant. That money will be used specifically to help those who've been recently laid off and become unemployed, help them find new jobs with businesses that are hiring, as well as be able to help them with resume writing, increase their job skills, those types of things. So we are continuing to be out there on a regular basis, addressing problems from the customers. On our socalgas.com website, we also have programs for women-owned, minority, veteran-owned businesses. It's our supplier diversity program. You can look that up and you can find out how you might be able to become a supplier to SoCalGas. Thank you.
Thank you, Leah. Don, go ahead.
Yeah, I'm back on. And I just want to mention too, Leah also serves on the board of directors of the Crona Chamber of Commerce. Thank you so much. This time I'd like to turn it over to Marc Uffer from Crona Regional Medical Center. Marc?
Yeah, good morning, everyone, and thanks for being on the call. Just briefly, you know, our hospital staff's done a really good job. We got, I think, a little ahead of this, been preparing for over a month. Staff's done a really good job. We've had to reconfigure the hospital to try to cohort the COVID patients into specific areas. I think the thing we face, like every other hospital in the country right now, is a shortage of masks, gloves, gowns. We've heard anecdotal stories of nurses in some areas of the country using plastic trash bags instead of gowns. So I think it's something that we're really focusing on trying to preserve. Certainly, you know, we have some community support with people making masks for the staff that are not really on the front lines, where we want to use the N95 and the surgical masks. We've actually only had 13 people that were actually admitted or came up positive. About 87% of our tests are negative, which is a good thing. Certainly, we're trying to focus on what the potential surge could be. But if you pay attention to the news, it's the areas that haven't done a good job of sheltering in place and restricting their movements. And those are the places where, people live on top of each other. Italy, New York, now Florida, Michigan. I mean, the areas where there's just a density of population, I think, are the ones that are at most risk, and if they don't follow the guidelines. But our team's done a good job. We feel we're as prepared as we can be. And we certainly appreciate all the support we've gotten from the community over the last few weeks, and that continues on a daily basis.
Thank you very much, Mark. Really appreciate your efforts over there and for being on this call with us today. Now we'd like to turn the time over to the Riverside County Economic Development Office. That would be Rob Moran.
Thank you, Mr. Chairman, and thank you, Bobby, for having me on the call this morning. I really appreciate the opportunity. Real quickly, before I introduce Dr. Thornburg, I wanted to mention that the county's economic development team is actively assisting businesses that are suffering during this time. We've created a central repository, a website, rivcobizhelp.org, RIVCOBIZHELP.org, that has a very comprehensive list of resources from state, federal, local level, recordings of webinars, etc. It's got our contact information. Please don't hesitate to reach out to us. And that's both for businesses that need help as well as workers that have been affected. We'll connect them with the right resources. As we suffer through this economic time right now, we know that it's tremendously impactful. And we'll be coming out of this in the next couple of months, we hope. And we want to have we need to have a good understanding of what's the future look like for us in our economy, not just in the region, but at the state and the federal level. And to give us his perspective on this, we're very fortunate to have, of course, UC Riverside here in the region, a preeminent institution. Through their School of Business, we have the UCR Center for Economic Forecasting and Development. And Dr. Chris Thornburg is obviously one of the preeminent economists, not just in this region, but at the state and across the country. And so we're very fortunate to have Chris. He's going to give us his perspective on the economy and where we go moving forward. And Chris, thank you for being here this morning, and I'll turn it over to you.
Thank you, Rob. I appreciate that. And good morning, everybody. Pleasure to be here. Yeah, I don't have to say what everybody has said. This is unprecedented, what's going on. We know the next couple of months are going to be tough. They're going to be tough from a social perspective with all the people getting sick and the deaths that are going to occur. It's tough from an economic perspective, given how a broad part of our economy has largely been shut down as part of the public health efforts to control the virus as much as we can. But with that in mind, I think what we need to be thinking towards is the second half of the year. You know, for those businesses out there that are struggling, those households that are out there struggling, the question isn't just what's going to happen and how are they going to survive the next couple of months, but rather what's going to come after that. After all, the decisions you make today are going to be really critical in terms of what happens in the second half of the year. So what is going to happen to the U.S. economy? How is this going to ripple? What does this mean for the overall year? Well, you certainly have heard plenty of negative opinions on this. Many organizations out there are predicting that the downturn the U.S. is going to experience is going to be on par, if not worse, than the Great Recession. They're predicting massive declines in economic output, big increases in unemployment, and of course, maybe even a decline in the housing markets. Now, as much as I appreciate how unprecedented and how big of a situation this is, I will also tell you that at our forecast center, we don't see this as a Great Recession type event. Now, it isn't to say this isn't a negative shock to the system. It absolutely is. This is by far and away the largest negative hit to our economy in a decade. But with that in mind, it is not a Great Recession type scenario. And let me explain why we make the distinction between these two events. When the Great Recession began, it began at the end of a massive inflation of the US economy driven by the subprime credit bubble. In those early years of last decade, you had a tremendous number a tremendous amount of just trillions of dollars of capital moving into the US economy, moving into American households. And that in turn created massive imbalances in parts of our economy. Housing would be one place where we saw, of course, unprecedented buying, unprecedented borrowing, unprecedented price increases. And by the way, the US was vastly overproducing housing. That also fed into the consumer sector. A lot of Americans took basically unlimited credit to heart, and they basically stopped savings. And we saw, of course, overall savings rate in the US economy drop to a very dangerously low level. In 2007, the subprime credit flow started to finally end. You know, investors realized that they were getting bilked and they pulled their money back. And when that flow of cash got cut off, you saw those big parts of those economy that were overinflated suddenly start to collapse. And the reason that's important is that after that started to happen, millions of jobs were lost in the US economy permanently. To put that in context, in 2019, the number of construction jobs in the United States was still lower than what it was in 2007. So those folks who were dislocated, who lost their jobs in finance, real estate, and construction, they had to go find new careers, build new lives in other parts of the economy. That is a slow, painful process, which is why the residual, if you were, of the Great Recession lasted far beyond the end of the technical end of the recession. For years, we had inflated unemployment rates. Now, let's come to the second quarter, first quarter of 2020. Right now, we have a truly, truly stark slowdown in the overall economy. We saw those numbers last week, over 3 million claims for unemployment insurance. We've never seen anything like that. But these job losses are not being created by any fundamental flaws in our economy. They're not being driven by collapses in parts of overall spending in our economy. Quite the opposite. These are actually the results of public health mandates. And the good news is, as soon as we get in control of this virus, those public health mandates will go away and those jobs will be able to come back. In other words, there's no permanent loss of jobs here. Rather, these are temporary job losses, job furloughs, if you will, driven by these public health mandates. Now, if, for example, for the sake of argument, do a little thought experiment, if tomorrow we came up with a cure for the disease, everything will get turned back on, and in a couple of days, we'd be back to normal. We all appreciate that. Now, unfortunately, I don't think that's going to happen, but the thought experiment remains. As soon as we're able to turn the economy on, to let people go out, to do those trips, to do their shopping, to go out and eat in restaurants, we know things are going to get better very rapidly. The big key here is the damage that's done in the meantime. Because look, you can't simply turn off revenue flows for a lot of small businesses, income flows for a lot of households that may have been at risk already, and not assume there isn't going to be some long-run harm. Of course there is. The key here, of course, is to put systems in place, programs in place to help those businesses, to help those households make it through the next 2 months, to make it through these tough times, so that when we do release the public health mandates, the economy can come roaring back. Well, the good news here is we're doing that. You know, it's interesting. The Great Recession began in December 2007. But the first stimulus efforts didn't actually go into place for an entire year. This time around, before we even had decent data, Congress had already put together one of the most unprecedented bills we've ever seen, $2 trillion of support for the US economy. Now, I'll tell you, any package that big put together that fast isn't going to be perfect. There's lots of holes in this thing, and there's parts of it I think that aren't very good, but there's lots of very good things. Expanding small business loans to the SBA, or expanding unemployment insurance benefits, making large loans to critical industries that may be hard hit in the short run, unable to access short-run credit flows to keep them stable through the next couple of months. Very good news. At the state level, at the local level, you've heard it already. The officials are there. The Riverside Development folks are there. They're there to help through these tough times. And even businesses are getting into play. You heard about SoCal Gas and how they're giving folks a little space in terms of their payments. Some large landlords in the state are doing a very similar thing. When you add it all up, what you see is a nation that's working hard to give those hard-hit businesses and those hard-hit households the support necessary to make it through the next 2 months. Once things do start to get better, once we are able to remove these mandates, we expect a very, very sharp increase in economic activity. So in other words, how we see this playing out is not years of protracted underperformance of the US economy, but rather a very short, sharp, intense, but ultimately temporary hit. Look for very scary numbers over the next couple of months. You're looking at unemployment rates, whether you're considering economic output. We could see a -10 to -12% hit to GDP in the second quarter of the year. That is how tremendous a shock to the system this is. But remember, as soon as the mandates are lifted, people are going to go back out. And boy, for those who think the consumers are going to be changed by this and aren't necessarily going to go back out and spend, I don't think you're paying attention to what it's like being in quarantine. Trust me, there is going to be some serious pent-up demand at the back end of this thing. People are going to go out. They're going to go shopping. They're going to go out to restaurants again. It's just a function of getting from here to there. So expect a very, very large bounce in the third quarter of the year. And by the fourth quarter, we may very well be back to where we were at the start of the year. Now, this all critically depends on us personally, individually, following public health guidelines. Listen to what our leaders are telling us. Stay home. Keep your face covered. They had a wonderful riff there that I've already forgotten, but they'll say it again, I'm sure, before the end of this. But again, you want to follow the rules. You want to control the spread of this thing, because the harder we work right now, the quicker this goes away, and the quicker we can get back to normal. So take heart. Don't let the super negativity, the hysteria you're seeing in the national press get into your head, because hysteria, unfortunately, is part of that system. Remember, 14 months ago, we were told there was going to be a massive recession driven by inflation and the Chinese trade war and the real estate collapse, a bunch of fears that amounted to nothing. This is a much more serious episode than when we were a year and a half ago. There's no doubt about it. But at the same time, unfortunately, the hysteria has been ratcheted up to the same degree. We get it. It's a tough time. You got to hang on. We have resources for you. The community is pulling together to help everybody make it through. Once we do, we're going to get back up and running, and very quickly this will go away. So be strong, be smart, and we're going to make it through it. Thank you very much.
Well, thank you so very much.
Dr. Thornberg.
Go ahead, Don.
Anyway, I thank you so much. It's always a pleasure to hear you, and we can't thank you enough for being on this call. And Bobby, you're going to close it out?
Yes, I will be. But I wanted to thank all the speakers again, and I'm getting lots of text messages. I wanted to go ahead and just share with you that next week, again, we will have Congressman Ken Calvert on the call. We're lining up some other speakers. If you're interested at all in still being on these calls and you are not part of the chamber board, please email Desiree, DESERIE @mychamber.org, or you can go ahead and email me. But I would like to open it up for just a couple of questions, because Chris, you did such a great job, and I know we have some. I know Judy Carpenter has texted she would like to have some questions as well. I would like to, before I get Judy on there, I just want to mention that next week we will be having a business resource town hall. Karen, can you briefly just talk on that? Unmute yourself. There you go.
Yes. Yes. This is in response for existing businesses right now, and there are resources available. It is very extensive opportunity to hear, as Mr. Thornburg was sharing some of the resources that are available. There are many out there for businesses. We want to share them in detail. Thank you, Rob Moran, who is coordinating this with us. So it's my office as well as the Crona Chamber, and of course, can't do it without Rob. So please take the opportunity. It'll be Tuesday afternoon, and we're going to send out more information as soon as we get everything solidified. Probably, I think it's at 2 o'clock, but Rob and I haven't confirmed that time yet, but it will be in the afternoon. We have a board meeting on Tuesday. That's the reason why I have to get the date, the time.
Thank you, Karen. Thank you so much. Okay,
Bobby, I have
Judy.
a question. This is Mike.
Okay, Mike, before we do you, I want to do Judy Carpenter. I cut her off, and then I'll come to you, Mike. Judy?
Thank you.
Thank you. I just wondered if there were any resources or if anyone, I don't know if the county level was going to put out a detailed analysis of the CARES Act. The reason I'm asking is because I've already gone through 2 webinars, updates from several law firms and accountants from the tax side of things, and there are a lot of different answers out there. And
Dr. Thornburg or?
Well, I'll just say, I mean, look, confusion is absolutely rampant. This goes back to the speed at which this thing was actually passed. You're right. There's a lot of things to be determined. How fast do they roll this out? How do you go about doing it? Everybody's trying to figure it out. I think these questions will filter up to Washington, D.C., and slowly but surely those answers will come out. Unfortunately, we're just going to have to be a little patient. You don't roll out a $2 trillion program overnight. This is truly unprecedented, and we're just going to have to wait and see.
I understand, but the applications process actually starts in just a few days, and from CMS standpoint, it already started for Medicare, and so.
Yeah. Judy, I want to have Eugene jump in real quick. I think he was sharing something.
Well, I'm not sure on if she's talking about Medicare, but as far as the businesses are concerned, I know the U.S. Chamber has put out a summary sheet that has quite a bit of information as it relates to businesses. And then one of our CPAs here locally did share the actual SBA form came out yesterday afternoon. I don't have a copy.
Right.
And
I've got it. It's on there, but there's just, I will tell you, the 2 webinars disagree with what the chamber put out. So.
Yeah, and I think that's going to be that way, like Chris said, for probably the next week or 2. And I imagine some will end up in litigation even after. So, because it is about as clear as mud, especially for people like us that had to lay people off, and how the employment, evidently there's some sort of a calculation, and the calculation is
right.
Okay, Bobby, if you don't mind, I'll jump in real quick. This
sure,
is
Rob.
Rob Moran with Economic Development, and those were great points. And what's happened is, and one thing that's kind of an overarching situation is that these, for example, like the economic injury disaster loan, it started off one way, and then the SBA relaxed some of the requirements. So there were several 100,000 people in California that were rejected, and they're actually going back to those folks. So unfortunately, what's happened is some of these programs are designed for smaller type episodes, and the SBA has been overwhelmed. And they're hiring, I think, 1,000 call center attendees. Their phone is on 24/7 now, so you can access that information. The CARES Act, for example, that you specifically referenced, the Paycheck Protection Program that came out through the, a lot of folks were using the Senate committee's guide. Well, that wasn't even a program yet, and so that's been widely disseminated. And then the regulations weren't even in place to actually implement the program, and it's changed. And it will probably continue to change because the final guidance hasn't come out. So there's a lot of moving parts. Certainly check in with us because we're trying to track it on a daily, if not hourly basis, because it is changing, and we certainly understand it can be confusing. So please don't hesitate to reach out, because these things are getting out there, but they're not even finalized yet. And then they're changing even after they're implemented.
Thank you. Thank you, Rob. Who was
Rob,
that?
this
Yeah,
is
Karen.
Karen. Rob, isn't some of this going to be covered next week on our town hall?
Yes, absolutely.
So Judy, if you haven't heard this town hall, you need to definitely chime in on that. It's very intense, very in-depth.
And Supervisor, we'll work with your office to finalize those
Okay.
details and get that out.
Yeah.
And we'll get
Thank
we'll
you.
get that information. That'll be out on our Tuesday morning weekly update for the phone number and all the contacts. It won't be a Zoom call through us. It's working with the county and their services. Mike Karashi, you had a question?
Yes, Bobby. As you know that our services are essential services, and we are providing touch point disinfection to all the businesses which are open. My other question is that is there any possibility, since our workers are out there, we can get some masks here locally? Does anybody know or anybody can help?
What do you need? Masks?
Face masks for our workers and for everybody who is out there disinfecting the businesses which are open.
Okay, we'll put that on the list. Desiree, if you'll go ahead and log that in, we can do the outreach. We've got lots of different people that are requesting them, so absolutely. Is there any other comment? Go ahead.
Bobby,
Yes.
now since the county's notice has gone out about everyone covering their face and scarves are acceptable and things, there's just like the East Coast, there's people locally that are starting to make the mask. So the chambers might want to put a call out for anybody that's willing to make and donate, because those would be useful.
That's a great idea. I know one of our executive leadership roundtable participants, her name is Fazia. She has actually done up over 1,200 of those masks. So we will outreach to them and we'll put it out on our website as well. So great idea, Judy. Thank you. I did want to keep this to 10, until 10:40. We still got a couple more minutes, but I wanted to just mention that we're going to be doing an outreach for healthcare workers. I know Mary Barnett's working with us on that. She gave us that idea last night. It's a flag program, and it's going to be something that we'll be sharing this next week. We want to also encourage everyone to shop local. We're going to do a 90-day challenge starting this Saturday. That is April 4th. 90 days later will be July 4th. It's appropriate for 90 days that we really work with our local community and outreach and show the support there. As well, we want to start having people display the American flag. It's time that people understand that America will pull through this. I wanted to remind you that this Friday we have our legislative Zoom call. If you're interested, contact Desiree or Linda Richards at our chamber. And our mayor, Jim Steiner, will be our featured speaker on that call. Wes Speak, you had mentioned something. You had texted me something real quick. So what was that about the parks? Wes, are you on? Okay, I'll get with Eugene real quick. You want to say something on?
Well, one of our suppliers, I'd reached out to them the other day, and they're right here in Brea. It's actually a t-shirt company. You may have seen them in the news. They
Yes.
switched everything over. They do have them. If people do want them, I put the price there. They're $6 each, and it would be a minimum of 5 per order. So if anybody wants any, email me direct, and I'll place an order with them. They're washable. They're not the super filtered, but they would comply with what the county is recommending, because if you were using a bandana or anything like that, it would be something similar to that. So they're washable. I mean, they're really good to keep your hand away from your face and mouth. And I think that's half the battle of what the county health directive is for.
And I'm going to just echo what he stated, because someone else has texted in here that, what if the people in their good-heartedness are making the masks at home, but there's no way to know if they're infected or not. And the t-shirt company probably has had their testing. So, it's a very sensitive thing right now. Any last minute questions or anything?
Hey,
Wes,
Bobby,
yes,
it's Marc.
you're on. Thank you.
Bobby, I wanted to say that we announced this morning that we closed all the playground equipment and sports facilities. Parks will remain open, but this is just kind of the next step, and that'll be released here actually in a few minutes, if not already.
Thank you so much, Wes. I really appreciate it. Mayor Steiner, did you want to say anything today, or are you saving it all for Friday, my friend? I believe it's going to be all for Friday. So,
Yep.
Mike Ryan, you had texted me something. Did you want to go ahead and jump on? Nope. Okay. So with that, ladies and gentlemen, thank you so much for being on the call, and we will be in touch.
If I may interrupt really quick, I
Yes.
don't know if you see it, but on the group chat, there's a few more questions that people have asked.
Thank you. So reading these texts, the mask will disinfect after 15 minutes in the dryer. Thank you so much. I really appreciate that, Danny. Masks, they're making of our fabric and must be disinfected before wearing. How long does it take to get them?
I'm gonna go ahead and place an order right now. So in a few minutes, I'll know what their backlog is. I know they were getting a huge order from FEMA, so I don't know. Every time I've ordered masks from eBay and some other places, I've gotten a few in, but most of them, the orders are canceled before they come in. But this company is close by, and so I'll find out. I'll order probably 100 of them right now and see how quick they say they'll come in.
Excellent,
Hey,
excellent.
you may want to reach out to AO Coolers. They actually, about 2 weeks ago, had said they had gotten a supplier, and one of their suppliers that does their fabric sewing in Nashville was going to crank up a pretty large order for them. They were expecting to get them in last week, so that might be somebody to check with as well.
Well, they're a long ways away. They're across the street.
Yeah, that's what I mean.
Keep your distance, Eugene. Ladies and gentlemen, I just again want to thank you all for being part of this. We look forward to doing this on a weekly basis for our weekly updates on Wednesdays at 10 o'clock. But again, this Friday, we have our mayor that's going to be part of our legislative action one. If you've got questions, feel free to email me. If you're not on our board and you want to be part of these calls, please just let us know. We'd love to send that invite out. Each one will be recorded, and we'll be sending that recording out later on. On behalf of the chamber, the business community, and our beautiful town of Crona, the real Corona, not the virus, thank you so much for being here. Have a great day.